Welcome to the Petri Dish. We're just opening up the room and allowing people to come in, so we're going to give a minute or two for everybody to get their technology figured out and their headsets on and get ready to go. So hang with us, but you're in the right place if you're here for Petri Dish, 4 ways to add revenue to your lab. We're going to go through a couple really neat ideas. But we're going to go ahead and give a minute or two just to let people get in, because that number is still climbing. It looks like we got about 45 people in attendance so far, and I know we had about 165 register, and this is going to be a session that's available as a recording afterwards, but you do lose a little bit of that functionality between being able to interact on the recorded session. So we appreciate you attending live. It gives you the chance to ask questions and react to polls, things of that nature. And while you're waiting here for people to continue to come in, I would draw your attention to the right side of the screen. You'll see some polls there. I have one opened up that you can go ahead and respond to as we wait. All right. Well, it looks like we've got most of the people that are planning to join. It looks like that number's tapering off, still people trickling in. But again, thank you for attending. We're put on by Lighthouse Lab Services, and this is a free webinar that we put on. It's free to present. It's free to attend. We'd like to keep it that way. Part of the reason we're able to do that is by our customers supporting us. So Lighthouse Lab Services, real quick. We do recruiting and staffing for the medical lab industry. We run the largest groups of medical lab scientists in the world on LinkedIn and Facebook. We build laboratories through our consulting division and build about 15 laboratories a year from scratch, and also do other consulting work there, LDT validation of new lines of testing, doing a lot of molecular work right now, mock inspections, things of that nature. And then we provide medical lab directors to 146 high complexity CLIA labs around the country. So I think we do more of that than anybody else, and would love to give you a quote and see if we can save you any money on your medical lab director. So that's part of the reason that this can exist and be free. So if you do need any of those services, we'd love to speak to you about it. But today we're trying to bring a service to you that can help you increase your revenue, right? So I speak with lab owners on a daily basis, and this is one of those areas. They're always looking for opportunities to bring revenue into their laboratory. We do have a poll that's up now that you guys can react to that says, are you actively looking for new ways to add revenue to your lab? Yes, always, not actively, but open to it, or no, just looking to make my current offering better. So go ahead and weigh in on that. We'd love to hear from you. Most owners that I speak with are open to it, but we're in an interesting position as consultants where I get to hear from owners regarding what their pain points are, their struggles are, and it's remarkably similar across different labs, but the owners don't like to share that with one another, or that's kind of rare, right? Because it's your competitor, or you just don't want to give away a trade secret if something's working. But this is a kind of a place to come, a forum to exchange those ideas. As I come across those out there in the industry, I like to bring those forward, and so we've distilled a lot of those down to 4 different ways that you can add revenue to your lab to talk about today. So we're going to go ahead and get started. We're going to be going through a couple different groups today. We're going to hear from Fritz at MyFitKey, who's going to be talking about a new genetic test for athletes. We're going to talk to Chaz over at Myndshft, who's got some prior authorization improvements, some automation to prior authorization. That's a mouthful. That I think is going to be really important, especially going forward, and we look at the trend on reimbursement there. And then we got Vic presenting a really neat artificial intelligence, machine learning application for the laboratory that I think is going to be pretty exciting as well. It looks like for the polls, we've had people weigh in, and 71% are always looking for new opportunities to add revenue, and about 30% are open to it. Doesn't look like anybody's not looking for that, so I'm glad you're feeling that way and you're in the right place. I'm going to go ahead and I'm going to turn it over first to Fritz from MyFitKey, who's going to go over a new genetic test that is available. He's just bringing to market, and I'll let him tell you a little bit more about that. So Fritz, why don't you go ahead and introduce yourself?
Thanks, John. Can you see my screen now? Okay.
Yes. Yep.
Well, hello, everyone. Okay, perfect. So hello, everyone. I'm Fritz Gartner, founder and president of MyFitKey. And to start, thank you to Lighthouse Lab Services for the chance to present at this Petri Dish event. I'm going to tell you three things about these three things. First, general and background information. I'm going to provide some specifics about how we do things. And finally, talk about the reasons for participating in this webinar, my reasons and your reasons. First of all, who we are. We are a genetics company doing DNA testing for athletes, which includes elite athletes, anyone who's interested in starting to exercise for any reason, and everyone in between. We reviewed the research, developed and validated the test. We wrote reporting software, including databases of genetics annotations. And we operate a CAP-CLIA facility in Houston, Texas. More about each of these points in a moment, but important to the who part of our story is our professional advisory board, which includes Dr. William Krause. Dr. Krause is a Duke cardiologist and a professor of medicine, currently the president of the American College of Sports Medicine, and also, very important for us, a top 100 finisher in the Boston Marathon. Dr. Dan O'Neill, founder of NASA Bone and Joint here in Houston, completed his fellowship in orthopedic sports medicine at surgery at Harvard, where he was also chief resident at Mass General. Dr. Eric Hegedus is our doctor of physical therapy. He's the founding chair and current director of High Point University's physical therapy department and a previous Division I college basketball player. He played for Bucknell. And Dr. Brian Merritt is a board-certified heme and molecular pathologist at Baylor Genetics and also our medical director. So what we do, we receive 2 buccal swabs from client athletes who have completed questionnaires, including sport preferences, levels of training, some medical information. Altogether, it's about 2 or 3 minutes worth of questionnaire efforts by our client athletes. And we provide a report in 2 main parts. The Fit Genes section about various athletic traits, and the PGX Complete section about how your body metabolizes different drugs. And we also provide a summary. Why we do this? Really because people need guidance. Elite athletes are looking for an edge, which is why every time we talk to a pro team or player, they are really interested in this stuff. Weekend warriors, they just want to stay healthy. They just need to get to Monday. There's a saying in the marathon training program world that you're training the weekend warriors just to get to the starting line. Forget about finishing the race. Just stay injury-free. It's really important. Beginners, including those who get told by their physician, their cardiologist, their neurologist, whoever, that they need to get in shape or else. Often beginners don't know where to start, and we can help them with that. More information in all these cases is better. So if in the past a trainer designed a program by noting a person's age, height, and weight, and apparent physical condition, and a few other things, now that same trainer will take note of all those same things, but also from our report, that person is going to get a genetic profile on their power and endurance, the risk of soft tissue injury, the risk of knee and ankle injury, and more. It's phenomenal what you can do with genetics these days. This is a strong scientific evidence-based product. To develop it, we consulted with runners, CrossFit, pro baseball, and many other athletes and developed a wish list of target athletic traits. Then we hired an independent third party to confirm if there was actually enough evidence to do what we set out to do. So all the research we use combines A, genetics, B, sports, meaning that it's sports-related research, and whatever the trait is that we're looking at. So if the research does not check all 3 boxes, we don't use it. And if there's not enough research, we do not include that athletic trait. So for instance, although there's plenty of genetics research addressing flexibility as the target trait, that research is primarily related to connectivity disorders such as Marfan syndrome. And that's not really sports research, so we don't include flexibility in our testing for now. Then we had our team of PhDs read the evidence, grade the evidence, and curate it. And finally, based on that evidence, we built databases of comments for the Fit Genes panel. All of that is proprietary. And we built the PGX complete databases based on Farm GKB and CPIC guidelines. So then, after all that, we built our own proprietary operational backend because there was no available software to report different gene-gene combinations for athletic traits, or gene and physiology combinations, or anything to report based on sport preferences or goals. Our ability to combine DNA results and physiological data into one report makes our report actionable. While pure genetics may indicate someone has great endurance, high VO2 max trainability, low injury risk, our report will also take into account the athlete weighs 350 pounds, has a history of high cholesterol, and for instance, has hypertrophic cardiomyopathy, and is therefore not marathon ready. Our report looks like this. We've got 16 different covers based on possible combinations of different genders, ages, and ethnicities. Our fit genes, or the athletic traits, are further subdivided into power and endurance, trainability, injury risk, weight and diet, and risks of certain health conditions. Our PGX Complete is a full-on clinical grade PGX panel, including copy number testing on CYP2D6 and confirmatory reads by Sanger. We cover 115 different drugs, plus caffeine, ethanol or alcohol, and aspirin, and provide clear stop, continue, and caution icons for quick references. And then we provide a readable summary, which includes these highlighted sections customized by athletes. So every athlete gets their own highlighted section, so healthcare providers can quickly see the most important parts of the report. So why am I here? We are seeking investment into MyFitKey to implement the commercialization strategy developed for us by an independent business advisory group. The product is ready to go. Now, we've developed the software, did the reports, the test, everything I showed you. So we need to go. But if investing at the organizational level is not in the cards, we are also interested in partnerships with labs which use the Agena mass array platform and are interested in licensing this test from us. And if interested but can't run the test quite yet, well, we're also looking for commercial partners with excellent relationships with general practitioners, sports medicine, orthopedic, cardiology, and other target providers, naturopaths, for instance, who are interested in this cash pay option. So that wraps up my three things about three things. We have 3,000 kits ready for shipping from our order fulfillment center. This is a tremendous opportunity to provide a high quality, medical grade, differentiated product to client athletes and patients and their physicians who recognize value. So please contact me if you are interested in learning more about working with us. Thank you very much.
Thank you, Fritz. That's excellent. I should have mentioned up front, and it looks like some of you have found it, there is a question and answer box on the right-hand side if you wanted to inquire about anything specific. We're not going to get into the weeds on any of these today, but high-level questions we'll try to answer. Other things might need to be taken offline. You'll also see a pop-up that gives you the opportunity to hear more information about MyFitKey, and we would connect you directly with Fritz and his team after. We do have a question, Fritz, if you'd be open to taking one.
Sure.
David is wondering how the science underlying MyFitKey's report differs from others that's in the market.
Well, I think you have to just look at the diligence of looking into that science and then sharing that science. So one of the important things about our report is that in the Fit Genes section and also in the PGX section, we will share with folks in the report what the quality of evidence that we used is to make the statements we're making. So we'll tell you this is gold level evidence or this is silver level evidence, and then we describe what that gold, silver, bronze means. So a gold level evidence is at least 10,000 subjects in a study, that it's repeatable, that it crosses ethnic lines, that it's done by major universities and things like that. So we will share that with people. If the question is my science better than the other science? I would have to tell you that we used a level of rigor that I believe is unique. The folks who are guiding us are very serious researchers and medical practitioners. They really held our feet to the fire, and we were thorough about vetting the research. Not sure if that completely answers the question.
I think it does. Hopefully that satisfies David's inquiry. Otherwise, David, feel free to follow up and we can connect you guys offline. We did have one more from Shalini, who was wondering about turnaround time. Do you guys have a benchmark for that at this point, or an estimate of what the turnaround time would be for this test?
Yeah, in the beginning, we're offering 3 to 6 weeks turnaround time, but that is going to come down as we get more tests and obviously can do some batching. But in the beginning, it's 3 to 6 weeks. In doing the research for this, by the way, I took some tests from the competition. I was actually shocked by how long it took to get back my results. It was a full 3 months, and we're definitely going to do better than that.
Excellent. And then one last one. Any professional teams using the test? Can you speak to that?
Great question. We are looking at that right now. Right now, the answer to your question is no, because we are really just starting our efforts to commercialize and to really get the word out there. I can tell you that the professional teams that we talk to are super interested, but they have not pulled the trigger yet because they're talking among themselves. Funnily enough, coaches seem to gravitate toward this really quickly, and then it winds up in the hands of trainers. Trainers put us through our paces, and so far those conversations have been good. Trainers are the ones who really want to look at the research and read the papers and all that, and we provide that. So all those conversations are good. We have tested individual pro athletes that I'm not able to name right now. We've done Olympic folks, professional football players, professional baseball players. But again, all of this is in the vein of getting ready to launch our product.
Excellent. Well, thank you very much, Fritz. I really appreciate that. Everybody feel free to continue to ask questions if you like. We'll make sure we get those to you, or we'll connect you with Fritz afterwards. Next, I'd like to introduce Chaz Bagwell of Myndshft, who is going to talk to us about some software innovation, not limited to, but including some improvements in the prior authorization process. So Chaz, if you'd like to tell us a little bit about Myndshft.
Yeah, John, thanks. We appreciate the opportunity from the best in the business. We're humbled to be here, Fritz. That was awesome. Very, very well done in the presentation. My name is Chaz Bagwell. I'm the Vice President of Business Development at Myndshft. I joined the company this past July. I came from the business development world, where I ran several large marketing services organizations selling for many labs around the country. When I really got into the weeds of the revenue cycle process, how the payers think about it, how providers think about it, how laboratories think about it, I just got to a point where I just knew there would be a better way, which is what brought me to Myndshft. So today we're going to be kind of talking about some of the industry trends and what we do. we like to think that we are using automation to put revenue cycle on autopilot by leveraging technology. So if we just take a look at a couple of trends here in the space, many of the people on the phone have noticed these. You've read about them, you've heard about them. Some of us are feeling the pain already from them, but they are as follows, and that's declining reimbursements. We know with things like PAMA, with things like prior authorization rules being changed, with shifts in the way that laboratory benefits managers function and reimburse for certain tests, that the reimbursements are declining, which has caused opportunities for growth, but it's also brought some pain. So we've seen an uptick in the growth in molecular and genetics testing in a response to this, diversifying both for patient care and to keep labs afloat, to continue to diversify their portfolio, both from a product and a payer perspective. We've seen a shift to value-based healthcare. That is not going to stop. And then one that I'd really love to touch on that I don't think we think about enough is a growing wave of consumerism. When I sold lab tests years ago, it was this idea that I was going to come in as a patient and I was going to be offered a test because my provider felt like it was medically justified to do so. And then I was going to make this transaction, provide a blood specimen, provide a urine specimen, a saliva specimen, and not have any idea where the specimen was going or what it was going to cost me, to then be billed 8, 10, 12 weeks later for a patient responsibility, either by my insurance provider or by the laboratory or by some collections agency. So as we've talked to a lot of patients and read a lot of trends and spoken with many labs who are facing these very pain points, we've heard that patients want to know what things are going to cost. Price transparency is a buzzword right now in healthcare. The pain points that have come from many of these trends, as we've discussed, by the sheer nature of a laboratory and its offering, you are removed from the visibility to a patient, requiring or relying on office staff or in-house phlebotomist or specimen technicians, collectors, to execute what we believe to be the start of the revenue cycle process, which is the requisition. It is making sure the appropriate demographics are there, the ICD-10s are there, the appropriate procedural codes, the medical justification, the prior authorization if it's needed on behalf of the provider. We're several degrees removed at the laboratory level in many cases, which increases claim denials for all sorts of reasons. Many of these are preventable if you leverage technology at the right place and at the right time. But prior auth rules have changed significantly. And many a times we don't know that Cigna changes a policy until 8, 10, 12 weeks after the actual change, when we start seeing denials come through in our revenue cycle process. So by leveraging technology like machine learning and artificial intelligence, we can pick up on these trends in real time and update the workflow to avoid the mistake from happening again. Write-offs and bad debt. Don't think I need to even elaborate with this audience on the pain point that this has caused for many labs. And tech and personnel. Hard to find good people. Thankfully, Lighthouse exists, but also hard to find folks who are experts in the revenue cycle process. But the game was meant to be difficult. And when the rules are changing as fast as they are without necessarily being as forthcoming as some of the payers are with telling us these rules, then we've got to use technology to maybe fix this. So your current revenue cycle process probably looks something like this. And a couple of themes that come from dozens and dozens of conversations that we've had and dozens of labs that we've helped, the process is reactionary. A majority of it is on paper for many labs. We don't know or can verify the benefits of the patient until after the specimen is gotten. 2 days later, it gets to a laboratory, and then we run a benefits check through multiple payer portals using multiple in-house staff to do so. So it's expensive. There is a ton of friction. There is a ton of reworks. And again, it is reactive and not done at the point of service where we believe the revenue cycle process starts. So your workflow may look a little different than this depending on your current technology stack, depending on your current innovation, depending on your current ability to adopt new ideas, or with the funds that you have or the tests that you offer. This may look a little different, but the theme still holds, which is denials are high, reworks are high, and many a times we find it that our billing company isn't necessarily meeting our needs, but in many cases, it may not be their fault. And so here's what I mean by that. By simplifying and automating the process, by leveraging technology like automation, like machine learning models, we can in real time determine if the patient has active insurance, if they're eligible for the test, tell you exactly what they're going to owe for this respective test, and determine if an authorization is needed, all within less than a minute. After, if we determine authorization is needed based on our payer rules engine, again, using machine learning models, then we will go ahead and submit and respectively monitor the prior authorization as well. So you can think of this as total automation from rec being entered into your current LIMS, into your current LIS, whatever your process is, whether that be e-order at the clinic level, or whether it be a paper rec that ends up at the lab that has been scanned or manually entered in at that point, whatever your current workflow is, we essentially come in and we're the engine or the plumbing underneath. So very small changes to your workflow, we're going to come in and grab the data and put it right back into the system of use so that your staff and or your collectors and or your physician clients in their offices don't have to change their workflows. If there's similar user experience to what they're used to. This is not an extra portal. This is not another set of credentials. It's not another vendor that you have to manage and worry about. This is simply just the plumbing via an API or other means of integration into your current tech stack. We believe that's important. We believe that the lack of interoperability in healthcare is real. We believe it causes major pain. By simplifying and automating the process, you can expect to improve your collections by metrics are showing us by as much as 20%, and reduce the manual effort in the overall process by as much as 90%. Not having to go to payer portals to find rules, not having to go and be reactive from a benefits verification perspective, having no idea what the patient's going to be on the hook for, and wait for the bill to show up 10 weeks later to bill it out to then cause physician abrasion and patient dissatisfaction. As a rep for years, I had to defend why healthcare works this way. Why do I have a transaction and buy a proverbial t-shirt to then not know what it's going to cost me, to then be billed 10 weeks later for the cost of that shirt? No other business operates like this. So we believe that price transparency is going to be critical over the next coming months. You can do all sorts of things with this. We've had labs set up the ability to collect that responsibility right then and there at the point of service, if you'd like to, or it's a simple disclosure. It's about expectations with a patient and a provider. What's it going to cost me? Right then and there, we can tell those metrics as well, based on your contracts, based on the in and out of network statuses, based on your fee schedules, et cetera, so specific to your laboratory. So essentially, we do these three things to recap. We do benefits verification and eligibility in a much more automated fashion than what you're probably used to, and in a much more accurate fashion than what you're used to. Our data is no older than 24 hours old. Many of the data that you're probably getting today is as much as 30 to 60 days aged, which is an eternity in healthcare. We don't go through clearinghouses. We connect directly to payers to get the data directly from them. Patient financial responsibility we've touched on. We have the most accurate solution in the marketplace. And the prior authorization piece, which is one piece of our value, we've built an entire national rules engine that houses all of the payer rules. And we essentially use web bots to emulate human behavior to submit these authorizations and to monitor. One of the biggest pain points is going back to these payer portals constantly, checking on the status of an authorization. We do all of this and apply machine learning models where it makes sense to continue to get smarter every time, to understand why denials are happening, to change the workflows respectively so they don't happen again. So our ask is essentially, we want to partner with laboratories to help you transform the way that you look at revenue cycle. We believe that the 20-minute conversation is no skin off your back to determine if this technology can help you. So please click the link if you feel like it can, and we'll be happy to go through your current workflow, help you understand our technology at a deeper level, and then help you understand what it's going to do for you from a return on investment perspective. But by using automation and leveraging technology, we can get our cost super low. That you just can't be met with, when you insert staff and human touches along the way. So my contact information is here if you guys would like to reach out. You also have the link that you can click there. And again, John and team, just want to say thank you guys for the ability to present today. We hope that we can help many of these labs with their revenue cycle.
Thank you, Chaz. That's great. That's exciting. I know that that's a pain point that is very close to home for most lab owners. I am constantly playing therapist to individuals that have a struggle with this. I had thrown a question out there about what the biggest struggle is. I see Sonny's weighing in with saying the unpredictability of revenue for non-par insurance. I think that is the constant struggle for everyone, and just adding any predictability to that revenue cycle piece and avoiding spending money on cost of goods for tests that you're not going to get paid for is a huge benefit to lab owners. And I think there's just bigger market forces that are pushing towards transparency of pricing as well. So hopefully we'll see some improvement in those areas. But I could see how this could be a great addition for any lab, and appreciate you presenting it. We do try to always bring solutions on Petri Dish that are not going to require a lab to make a drastic change, right? So this is one of those examples where it can plug right into your LIS. The one that's coming up next is Vic from UMethod, who's also going to talk to us a little bit about how you can apply AI to lab data that you may be already producing on blood panels. And so thank you, Chaz. We're going to go ahead and shift over to UMethod unless there's any other questions. I don't see any out there. I don't feel like there was a whole lot of ambiguity about what you guys did, so hopefully there'll be some interest for further conversation, Chaz, and we'll get that information over to you as it comes in.
Thanks, John.
So we're going to introduce Vic, and Vic is with UMethod, and UMethod uses artificial intelligence to provide some more treatment planning options and some really unique opportunities for physicians to earn revenue, which gives your sales force a strategic advantage out in the field to win business. And that was what really hooked me about this. I like multiple different aspects of it. The fact that if you're already doing a lot of this testing, it's gonna be just a simple add-on with a very low risk. So I'm going to turn over the microphone to Vic to tell us a little bit more about UMethod.
All right, John, thank you, and thanks to everybody for joining. Today, I'm thrilled to have the opportunity to speak with you. What I'll do today is I'll take you just a little bit through what we do at UMethod. We'll talk about how we partner with reference labs in a manner that does help grow revenue as well as expand your market footprint. And the solution we're talking about today is covered by insurance, so there is reimbursement out there for it today. A little bit about UMethod first. We are a technology company, so we are not a lab. We're a bunch of squeamish software people. We don't want to see blood, ideally. But the only way we go to market is jointly with labs. So we're effectively a artificial intelligence solution provider to labs. We will be expanding our solution portfolio, but today we're going to talk to you about our first solution, which targets patients with cognitive decline. So we'll touch into what we do differently with those patients and how the solution is actually delivered jointly with labs. We are a precision medicine company, so we are enabling physicians in collaboration with labs to utilize personalized treatment methodologies to provide better care for patients with chronic diseases. The chronic diseases also tend to be complex diseases, so these patients have multiple issues simultaneously, and we need to do a significant number of tests on these patients to identify all of their drivers and contributors to these chronic diseases. From the perspective of the larger healthcare segment, 86% of our healthcare spend does go to chronic diseases, so any opportunity to address those issues better not only drives revenue for all of us on the phone, but it also helps the larger society as well, and that's just part of the goal of what we do at UMethod. Right, let's touch on a little bit about the whole cognitive decline space. We use the term Alzheimer's disease. We talk about mild cognitive impairment patients. Regardless, we're talking about patients that are beginning to have cognitive issues. We work with patients that are Medicare aged, so 65 and older. And these patients today who begin to have these cognitive issues really don't have anything out there that their doctors can prescribe for them to help their cognitive issues as they begin to decline. And a significant percentage of the population does decline. So monotherapies just aren't out there for this patient base, and the purpose of this chart is to show that it's not for a lack of trying. As a society, over the last 20 years, about 300 drugs have gone through FDA trials and failed. And what researchers are recognizing is that the spectrum of Alzheimer's disease and other complex diseases are complex in that they don't have a single cause. They have multiple underlying causes. These patients have 5, 10, 15 active issues that are causing their cognitive decline or their other chronic diseases. And the way to address these is by applying combinations of treatments in a personalized manner so that we're addressing all the underlying drivers and causes of particular diseases. So at UMethod, we are the first to market with a multi-domain approach to treating cognitive decline. And again, as I mentioned, we do not go to market directly with physicians. Our solutions are our treatment plans. They provide physicians guidance on how to take better care of these patients, how to utilize existing interventions with these patients in combinations, but the solutions are delivered entirely with reference labs. Okay. So what is it that we have? We have a new test that's actually a panel that's made up of tests that you as a lab owner, operator likely already have in your portfolio. You guys probably do those tests today. We are not looking to add new tests into your portfolio. But this is eventually delivered as a program that a physician offers to their patients. Everything is delivered under reimbursement, so there is no out-of-pocket costs to the patients or the physicians. And it's a very, very data-driven approach. I mean, if you see on the right-hand side here, you see as a part of this treatment methodology that we've developed, we're pulling together information from test results, information on the patients, including vitals, demographics, medications list, comorbidities, and we process all of that information with our advanced technology. What we've done is we have worked with leading Alzheimer's researchers and practitioners on our to develop this methodology. We have leaders from Cornell University, Cleveland Clinic, Duke University, and so on that have worked with us to design a treatment methodology that's very dependent upon all of this patient information, including test results. And the result is a personalized treatment plan for the patient that's actually utilized and practiced in conjunction with their physician. Just like some of the previous discussions we've had today, we don't actually do the research. Our entire analysis is based on research that's already out there. We have curated that research jointly with our scientific advisory board to develop this treatment methodology. And the patients who follow the care plan are actually do far better than the standard of care. Based on our work and work of others, we see 3/4 of the patients actually doing better than the standard of care in terms of their memory function. And there are peer-reviewed papers out there on this. Happy to get into those as we have further discussions outside of this venue. So let's talk through what the clinical process looks like. So we work primarily in primary care. So for labs that have a primary care audience out there, the solution is a good fit. In the primary care environments, the physicians are already required to assess the cognitive function of patients. And for patients who are declining in a measurable manner, and we're talking about Medicare-age patients, the doctor informs them about a new program that they have and orders a set of tests on those patients that are organized into a nice, easy-to-order panel. They can, of course, order individual tests in that panel. The testing is all done by our partner reference lab. We'll process those test results, and we will eventually create and deliver reports which contain a slew of information in them, including treatment recommendations to that doctor. The doctor then, of course, utilizes that report in the care of their patients. Just to give you a sense of it, today our panel consists of 42 different tests. That's non-genetic tests that provide us with 107 results. We'll use that information along with genetic information if it's available either from genetic tests or PGX tests, and we'll combine that with patients' vitals and demographics and medication history and comorbidities, and then our solution produces reports that tell the doctor, hey, this patient has these 5, 10 issues. We'll recommend additional diagnostics that the doctor should get done on that patient. We will provide a multi-domain personalized treatment recommendations, and of course medication management is a part of the solution as well. So we produce reports. You can see some snapshots of those in the back that are delivered to physicians that are then utilized as a part of caring for their patient population. The patient base that we address is, again, in the primary care environment. There are about 6 million or so patients in U.S. which are over 65 that have mild cognitive impairment, and another couple of million patients that are in the early stages of Alzheimer's or dementia. So there are about 8 million patients out there that can benefit from our methodology today. And with the reimbursement that's available, that's out there, it can be a very substantially large amount of reimbursement that's available from CMS for this patient population, specifically targeted towards the care of their patient's cognitive function. Just a little bit about the reimbursement. So off on the right-hand side, you see Medicare. So Medicare has come out with some new codes. This is a Medicare initiative that is designed to encourage the physicians to create comprehensive care plans for their patients with Alzheimer's and dementia. This was a new set of codes that originally came out in 2017, and they became permanent codes in 2018. And because of the large cost that Medicare and CMS has to bear for patients with cognitive decline, they're really encouraging their patients. Their physicians to go far deeper into the care of their patients. So for every care plan that a physician produces, there's a fairly significant amount of reimbursement that goes to the physician, and the analysis that we do and the reports we provide to the physician helps them create the care plan. So this is not their entire care plan. Our reports are a part of the care plan that the physician would create. For the testing that's done behind our analysis and behind our reports, there's a $500 some odd in reimbursement that goes to the reference lab. And in addition, where appropriate, a PGX-10 test can be done on the patient as well, which increases that reimbursement. So our business model is to partner entirely with reference labs. We're not out talking with physicians directly. We go to market jointly with reference labs, and we're very fortunate to be working with labs such as Sonora Quest out in Arizona. Some of you guys may be familiar with them. And that allows us as a startup, as a small company, to reach the physician base of a particular lab and the patient base behind them. So there is an opportunity here for the lab to be able to serve its physician base better with a unique new offering while growing its revenue. And there's an opportunity here for physicians to provide better care to their patients with cognitive decline while also capturing some of the additional reimbursement that is out there. So what we're looking for, we're a startup, and we're looking to grow our base of partners, our lab-based partners that we're going jointly to market with. As I mentioned, we're very fortunate to already be working with labs like Sonora Quest and a few other labs, but we've barely scratched the surface in terms of the coverage that we have across the nation. So if you're outside of Arizona, we would love to speak with you. as a solution, we do add a new capability that your sales reps can take to market that's very differentiated, and it is an opportunity to grow your revenue from the larger panel as well as from the fact that the solution could potentially help a physician grow its business as well. The way to get started is to reach out to either myself, Vic Chandra, my email address is here at the bottom of the chart, or reach out to our Chief Commercial Officer, Paul Sanders. Please send us an email and we'll get right back to you and take you through a deeper dive on what the panel looks like and how would we get started with your team quickly. Look, we could be jointly in the market with you this year, and since this is a Medicare-based initiative, this can begin to contribute to your revenue starting in January. I realize we're sitting right before Thanksgiving at this point in time. The process is relatively straightforward. We'll want to make sure that you're able to do the set of tests that are in the panel. We'll want to make sure there is an operational fit. We'll make sure this works as a business for you. We don't make money until you make money. And there's a simple contract, and then we start to train your sales force with a really simple behind-the-scene technology integration. So if we were to get started, we could be out in the market with you jointly by the end of the year and driving revenue for both the organizations starting in January. I certainly hope this is of interest, and we look forward to hearing back from you. And for any investors on the call, we are working to raise our Series C at this point in time. I'd love to hear from you if you have an interest in investing in technologies that are designed to strengthen the businesses of reference labs.
Thank you, Vic. Appreciate that. Yeah, that's great. I really like this offering. I think it's really relevant with baby boomers aging and cognitive decline becoming a bigger and bigger issue. And I'm sure lab owners would appreciate the fact that with it being reimbursed by Medicare, you have a lot more stability and predictability to your reimbursement for your efforts. We did get a question that came in from Doug, and he wanted to know, is this process incorporated in the patient survey as part of their managed annual wellness visit and chronic care management programs or not?
That's a great question. So as a part of the annual wellness visit, the physicians are supposed to, or physicians or their staff are supposed to do a cognitive test on the patient. So the annual wellness visit becomes a important point for identifying patients that would be a fit for this methodology. When we look for physicians that are ideally a good fit for this kind of a program, we do want physicians that have a couple of different characteristics. One, that they are doing the annual wellness visit, and the second, that they do have a phlebotomist either in the office or somewhere really close by, so that when a patient learns about this program from their physician, they can actually go and get a blood draw right there and then, so that the process can get started quickly. So annual wellness visit is an important feeder into this program.
Excellent. That makes sense. All right. Well, appreciate it, Vic. We are up against the clock a little bit, so we're going to move on. Last thing we're going to present, I'm going to go really quickly through a new offering that we have here at Lighthouse that might be helpful to individuals and labs as well. It services the direct-to-consumer market. And so it's a physician of record or physician in the cloud network. Due to demand, we've been hearing from a lot of labs that use other services. There's one big one that does lab test order approval for direct-to-consumer and does it for Quest and some of the big boys. And there's been some frustration with that. And so we wanted to bring an alternative to the market. So we have MD pathologists located in all 50 states that are working in our labs as laboratory directors. And so we've kind of consolidated them or put them together into a package to be able to do lab test ordering and approval for groups that are looking to go direct to consumer. So if you have a test and you'd like to offer it in other states, but are a little bit intimidated by the direct access testing rules, where some states allow it, some don't, some require a physician signature, the authorized official is different across that landscape, can be very challenging. But it's a big market. I got a graph on here that shows the growth of the direct-to-consumer market just over these last few years, and you see it's exponential, and I think it'll continue to just take off from here. It's really just starting to catch traction. But in order to power that, or to offer your test as a direct-to-consumer, you have to be able to navigate the regulatory of the different states. So what we're offering today is a very simple solution. We're kind of hitting it with a hammer. We're going to put an MD signature behind every lab order, regardless of requirements. So even if a state does not require it, we're going to go ahead and do that, and I'll tell you why that will be no additional cost to you to do it that way, but it does, streamline things a little bit. We have MDs licensed in all 50 states, including DC and Puerto Rico, to go ahead and approve that. And we felt like we just wanted to build it with one workflow so that it would be simpler. So how does it work? You would sign up with us. We would either plug into your technology and have our physician network log into your technology to review and order those lab tests and then flag and release results. We do a flat fee, so compliance is a big part of this. We've gone back and forth. PWN is the only big group doing this right now. They charge, around $12 per sample. We feel like it's a little bit high, and we don't like the potential inducement back to the laboratory by paying a physician for every test they order, incentivizes them to order more tests. So our offering is a flat fee. It's $4,000 a month and unlimited number of lab tests ordered in all states. So the reason we did that, like I said, was just for simplicity of workflow, as well as for those inducement. We just wanted to make sure that we kept all labs that we introduced into this on the high road, and we felt putting an MD signature behind every order was the way to go for that. If you do not have the technology for our physician network to plug into to do that, we do have a third party that we use that can provide a patient portal, physician portal, through an app, through a website, can also handle the collection of funds and the rest of that if you do want to offer your services as a direct-to-consumer offering. So just wanted to make you guys aware of that. Keep it in your back pocket. I know there's a lot of entrepreneurs on the call and might want to know what's available to them. So I really feel like this handcuffs you to be able to look at a national landscape, look at different tests, look at a test like a MyFit Key or some of these that really lend themselves to direct-to-consumer, and not have to worry about the complexities of getting an MD in every different state and having a different relationship and workflow for all those. So if you want any information on that, I did put the pop-up there where you can ask for more. If you have any questions, I'd be happy to field those, but I do want to be respectful of your time. I know we're coming up on the hour, and we do try to get this done in 1 hour. I did put a poll up just asking about the format. Hopefully you guys like this. It seems like overwhelmingly 86% of people like this format, where we try to get in pretty quick and let you hear on a lunch break of multiple different ideas, innovations, offerings, opportunities. Just bring things that you can quickly determine whether they're something that you're interested in hearing more about or not. We haven't gone super deep into it. That would be the objective of that follow-up call, right? We realize that you wouldn't make a decision to move forward with just the information you hear here, but hopefully this is enough to help you determine whether it's a fit for you or not. So it looks like, based on the poll, that we would keep this format, but always looking for feedback. So if you have any ideas on that. Also, if you know of anybody that you think would be a good presenter for the Petri Dish, we'd be happy to vet those. We do get a lot of people interested and try to vet it down to things that really do add value to you as a lab owner. If you're interested, though, feel free to reach out. If you have ideas for topics, that's another thing that we're always open to. So just let me know. But I think that'll wrap it up for us. If there's no questions, we'll let you guys get back with your day, and hope you enjoyed it. And there will be a recording that will come out. It'll automatically be sent out to all the people that registered, so you don't have to do anything to receive that. And we will post it on a YouTube channel as well, but it might take us a few days to get that up and posted. But thank you all for joining. Thank you for our presenters today. I think we had the best collection of names with Fritz, Chaz, and Vic today that we've had so far. So I appreciate you guys sharing your knowledge with us and spending a little time here. Thanks, everybody.